Good afternoon, ladies and gentlemen. I'll be speaking about something nowadays very useful in the diagnosis and management of infectious disease, which did not exist in the time of great Hungarian scientist Semmelweis. And I like to start with something very memorable. This gentleman, for me, the most known Hungarian gynecologist and very good friend of us, 20 years ago proposed three of us, Frank Červenek, Roberto Romero, and me, for this high honor, doctor's honoris causa of your 260 years old university. And needless to say that we all appreciate. After that, we received some more doctor's honoris causa from different universities, but the first one is always most memorable. And I still remember in this building, 20 years ago, ceremony for delivery of this doctor honoris causa happened. So thank you very much, Zoltan, and I'm sure I speak for Roberto and for Frank, saying that we are proud indeed to be owners of this high recognition. How ultrasound helps? Ultrasound in meantime became most useful single method we have in both obstetrics and gynecology. So we have non-specific findings like hydrocephaly, microcephaly, ventriculomegaly, non-immune hydrops, cardiothoracic lesions, and we have specific findings which will help us to diagnose certain syndromes so elegantly described by Roberto Romero. I will not go in most of these because paper was produced when information was that it can last 30 minutes. Now I will finish within 20 minutes. So what ultrasound can do? Exclude or identify anatomical defects of fetal heart and brain and detect thoracic and abdominal lesions. And that can appear in the form of echogenicities in organs, fluid collection in body cavities, and abnormal growth. Ultrasound is almost ideal method to visualize them, and I will show you how classic, routine ultrasound, B mode, how 3D power Doppler, how 3D silhouette do produce pictures so important for diagnosis infection. Most common congenital infection is cytomegalo infection. I could speak half an hour about that, but I will not. I will just say the sequelae, ocular defects, sensory neural deafness, hepatosplenomegaly, and as Roberto illustrated, even neurodevelopmental consequences as the most important cerebral palsy, learning disability, and epilepsy. Just to remember that on neonates we can have petechiae, hepatosplenomegaly, jaundice, microcephaly, and in late features we have deafness, mental retardation, spasticity, chorioretinitis, so many very important problems. I will not go. Amniotic fluid and diagnosis was elegantly discussed by Roberto. He helped me very much. But ultrasound findings in cytomegalovirus are microcephaly, cerebral atrophy, ventriculomegaly, intracerebral calcification, periventricular cyst formation, and so on. So you see here how periventricular echogenic halo, similar to described by periventricular leukomalacia, mild ventriculomegaly, irregular chorioid plexus. And first two images represent view at the level of bodies of the lateral ventricles, and the striking finding is the marked periventricular echogenicity proved by postnatal magnetic resonance. Microphthalmia, hepatic calcification, and then hepatic calcification, are pathognomonic signs in this problem. But apart from cytomegalovirus, there are human parvovirus B19 producing many problems in present fetal status, and later on, and adults, about 60% have serological evidence of prior infection. So ultrasound and serology are for me, equally important to diagnose and manage all of these problems. I will not go in human parvovirus, but just so that miscarriage, anemia, non-immune hydrops, intrauterine death, and complete recovery can be sequelae of fetal infection. Diagnosis goes on maternal infection, but again in amniotic fluid, human parvovirus B19, and the serial ultrasound starts on 4 weeks after onset of illness or date of seroconversion, and then can be done at 1 to 2 weeks interval up to the 12 weeks. So, and some pictures illustrating typical findings. Non-immune hydrops. Of course, with this picture you cannot say is it immune or non-immune, but it does stimulate you to go further in discussing this, in understanding this important ultrasonic sign. So, fetal hydrops in parvovirus B19, typical picture, hydrothorax, free fluid in surrounding thorax, hydrothorax again, cardiomegaly and pleural effusion as a part of parvovirus syndrome, and again myocarditis, early calcific pericarditis, thickened myocardium between arrows, early pericardial calcification, and of course huge placenta, which every one of you will maybe first notice, and polyhydramnion. So huge placenta, polyhydramnion, or sometimes oligohydramnion are another markers for infectious disease detected easily by ultrasound. And again, normal lung, hydrothorax, just to see what really can be done. Another problem is toxoplasmosis in pregnancy. Is acquired by ingestion of toxoplasma tissue cyst in undercooked or cured meats such as parma, ham, or from infectious oocytes which are excreted by cats or which are present in contaminated soil water. Enough about this, but fetus may contract toxoplasmosis through the placental connection with its infected mother, and mother may be infected by improper handling of cat litter and handling or ingesting contaminated meat. Toxoplasmosis now is not a big problem because screening and prevention have, but you see consequences if it is not treated properly. And ultrasonic findings are serial scans every 2 weeks may identify markers which are mainly progressive ventricular dilatation, cerebral calcification, ascites, and hepatosplenomegaly. All of them easily detectable by ultrasound. So if you use CT, you will have some more information, but not anything new what ultrasound did not detect, but not just any ultrasound. When I speak about 3D ultrasound, you will see a picture when it is better than magnetic resonance in the field of brain. Rubella in pregnancy is very well known, and the vertical transmission occurs during maternal viremia. The risk of fetal infection is 90% before 12 weeks, 55, 12 to 16, and 45 after 16 weeks. Diagnosis of maternal is outside of my scope of my lecture, but even fetal infection and congenital rubella, just to remind you on the microcephaly, cataract, and blueberry muffin baby, so pathognomonic for congenital rubella, hepatomegaly, regular signs, septal defects, which again can be detected by ultrasound, microphthalmia, and how we manage infected fetus is not subject for this. Varicella zoster and recently Zika virus have certain significant influence on the infection. And just to say that varicella syndrome is characterized by limb defect and limb hypoplasia, where again ultrasound is method of choice to detect it antenatally. So congenital varicella syndrome, some illustrative pictures of neonates, and ventriculomegaly, hydrocephaly, echogenic bowel, almost the same signs as we do have in other infected fetuses or mothers. Other uncommon infections are syphilis, characterized by hepatosplenomegaly. Somebody showed this morning how syphilis affected brilliant scientist not to produce his best. And I will now come to the point, to my lecture. One picture tells you more than 1,000 words. Was Chinese philosopher Confucius who said, and how ultrasound visualize very frequent marker for infections. You can see here typical picture of modern 2D and 3D. You can see free fluid, you can see intra-abdominal organs. When we put these three orthogonal pictures by computer into the one, we have 3D picture of liver, of intestine, free fluid. You really shouldn't expect better and more beautiful ultrasound reach. It's significant, climax with these pictures. 26 weeks, we can use 2 coronal image demonstrating large amount of ascites, and 26 weeks, again, large amount with intra-abdominal organs. And this is typical picture, 28 weeks. You see polyhydramnios, increased fluid outside, and increased fluid inside abdomen. When we use three-dimensional pictures and visualization improves significantly, you see fetal liver, you see intestines, and you see how this looks with 3 dimensions. Again, ascites and pleural effusion, hydrothorax and edema, ascites again. Some limb deformities. Limbs do contain very important diagnostic information for many trisomies, and it's routine part of serious examination by 3D sonography. Just few pictures of abnormalities, and good examiner should really look for that. And clubfoot, 22 weeks of gestation, is very frequent consequence of maternal infection. Again, you have here adducted thumb. In our research for cerebral palsy, lasting 10 years, adducted thumb, we call it neurological thumb covered by the fingers, is not visualized. That was in large 10-center studies, the most important sign of cerebral palsy. And we now have 11 cases of cerebral palsy detected antenatally, best cases in a long history of modern obstetrics. We shouldn't forget fallopian tube. The fallopian tube are frequently place of sactosalpinx, of hydrosalpinx, of inflammation. You see that this new technique visualizes full length of fallopian tubes and uterus together, and very recent hypothesis of 7 papers published in prestigious journals is that ovarian cancer, the most disappointed part of modern gynecology, early diagnosis does not exist. It's just a matter of chance rather than triumph of any scientific method. And we are looking for screening method, and no one failed. There are about 80 attempts with computer, without computer. No one is better than subjective assessment of experienced expert who will say yes or no, it is, ovarian cancer or not. So majority of high-grade serous cancers are of Müllerian, not mesothelial region, and arise in the fallopian tube before spreading to the ovary. So that means that ovarian cancer in most of the cases starts as a fallopian tube cancer. So if this is true, it is still work in progress. I know 7 papers about that. What would be prevention potential of bilateral salpingectomy if tubes are source for most serious, most dangerous female cancer? Then we should think about salpingectomy even if this is normal. This is visualization of fallopian tube and some mass protruding. Be very careful in characterizing this protruding mass because it can be cancer, and it is compulsory for any ovarian cancer, endometrial cancer, to develop vascular angiogenesis, tumor angiogenesis, to allow tumor to grow. And this is a case when color Doppler helped us to diagnose primary fallopian tube carcinoma. Very seldom it is done because we all put it in adnexal mass and diagnose ovarian cancer. So, just to remind you to think about, research question is distal fallopian tube an origin for serous carcinoma in patients without genetic mutation? It has to be answered. But picture on which we see distal part of fallopian tube, and then you don't need sophisticated 3D to detect it. This is tubular structure in hydrosalpinx with conventional method. This is with debris in left adnexa, and this is piosalpinx detected non-invasively. And fallopian tube are difficult to be detected by 2D, but easy when we have free fluid in pelvis or tube, so inside or outside the tube. So significant advances happen in visualization of full length of fallopian tube, and several examples showing normal, abnormal, patent, non-patent fallopian tube, and power Doppler sonogram showing increased flow to the wall of tubo-ovarian abscess. Again, color Doppler, particular 3D power Doppler are helping. Anemia is important for some of the infections. Study of middle cerebral artery to detect anemia is quite helpful and can detect almost in all cases if anemia is present. That brings us to the therapy. So we are entering fetal blood flow every day by chordosynthesis. You can see needle inside the umbilical cord, intravascular transfusion, which improve immediately, middle cerebral artery. Cranial signs, again, are ventriculomegaly, hydrocephaly, fetal skull edema, hydranencephaly, intracranial calcification. Very, very important. Whenever you have doing biparietal diameter cephalometry and so on, and you have calcification, do think about infection. But this slide tells you more than 1,000 words. In present controversy on the use of either 3D ultrasound or magnetic resonance, this picture is very convincing. To be very honest with you, last year I used only once magnetic resonance in a large scale of patients. And magnetic resonance is needed there when ultrasound is not good. Ultrasound, but 3D ultrasound, magnetic resonance and ultrasound, 3D ultrasound have been born 30 years ago. So any comparison for journals and so on about value of ultrasound must go to 30 years to combine 3D ultrasound and other magnetic resonance. Ventriculomegaly, lovely picture. And new field, I need next 2 minutes, Zoltan. New field, fetal ophthalmology, is just starting. Ultrasound progressing thanks to technology. You can see congenital cataract with microphthalmia. You can see microphthalmia at 12 weeks, important sign for some malformation. 12 weeks here in case of trisomy 13. And you can see facial appearance with microphthalmia at 12 weeks. We are so advanced, in particular our friend and partner Ritsuko Poo from Japan, to study vascularization, to detect hyaluride artery, and to study even, some more details about vision in fetal life. That is visualization of fetal eyes and details, anatomical details. And in abdomen, we have bowel dilatation. Non-cardiac abnormalities also detectable by ultrasound. Just few slides about Zika virus. You are lucky country, and my country is lucky. We have any one case of Zika virus. But Zika virus was 2-3 years ago even appearing on the front page of journals like Wall Street Journal. And Zika virus transmission to people go through sex and through blood transfusion. And severity of condition may depend on the timing of infection during pregnancy, and periventricular intraparenchymal calcification, cerebellar hypoplasia, microcephaly, they all are signs. Roberto Romero is very much involved in study of cerebral palsy. And we've been involved from different point of view, a little bit different studies. Cerebral palsy, ladies and gentlemen, is the most frequent chronic motoric disability in childhood. It is functional. Half of our cerebral palsy patients had no any anatomical, any morphological problem. They are functional defects affecting motor cortex. Motor cortex is now subject of intensive studies. We even produce tests called CANET, who can antenatally separate neurological problems from not one. Then we move to sensory cortex, and every one of you who remember this picture, these boys had normal pregnancy, most of them. They have been born with Apgar 10. They stayed 4 days in neonatal intensive care unit, went home as healthy children. Mother, not doctor, after 2 years, detected the problem. So cerebral palsy, 90% of the causes are in utero. And this is really responsibility of obstetrician. And Roberto Romero, for me, the best editor in the world of the best journal, of course, published in 2015 this graph. And I think every one of you should take this graph at least in your memories to your home, showing that we are living in era of tremendous increase of cesarean section. Many problems with this. But six-fold increase of cesarean section resulted in no changes in incidence of cerebral palsy. So what else we should do? Incidence of cerebral palsy did not change since 1952. And I, with all of my modesty, predict that next 10 years, obstetricians and conference like this must concentrate on origin, diagnosis, and management of cerebral palsy. We are already very much into the scientific interest. Fetal behavior tell us about brain function. In PubMed database from 2000 to 2016, you see dramatic increase of interest. And WHO promoted this decade of the brain, of the mind. So most investment of European Union, 34%, goes to the research of the brain. And in that field, ultrasound made unbelievable progress. If you look at this picture here, this is so-called 3D HD silhouette ultrasound, already available at the market. You see intracranial structure, you see everything what is inside the body. And you see 16 weeks ventriculomegaly, you see lateral ventricles, you see enlarged fourth ventricle, and that is probably promising in detection of cerebral palsy, which I do believe is cerebral obstetric problem, because 90% origin in utero, and the incidence didn't change since 1951. Who should detect them? You and me. When? Tomorrow. It's already too late. There is test which helps, and prevalence is 1 to 4 per 1,000 live-born babies. In America, there are 1 million adult people with cerebral palsy. So, ladies and gentlemen, coming to the end, it is now 38 years since we have one educational institution, the largest educational institution in the world. This is Young Donald School, and in Young Donald School we have 140 countries, you know, and one of the most active is your Hungarian. And I thank Zoltán Pap and his team on behalf of Frank Červenek, me, and many other top doctors for making Donald School so visible in countries. So, if you like to hear more how 3D and 4D ultrasound change profile of our profession, welcome in this city which Hungarian people loves. This is Dubrovnik. This is a Croatian city, and from the 21st to the 24th of March next year, we have the 3rd World Congress on 3D ultrasound in obstetrics gynecology. Warm welcome, and stay a few days longer to improve economy of Croatia. Thank you.